Good evening, Dr. Sri. So I'm going to present you my first assignment for landscape architecture research methodology subject, and have selected topic roles of urban parks for healthy living environment during COVID-19 outbreak and future pandemics. And I have selected Professor Landscape Architect, my dear Landscape Architect Dr. Haji Usman bin Muhammad Tahir as my supervisor, and yourself as my co-supervisor. So introduction about my topic. As we know that the current break, the COVID-19 outbreak, which is originated from China, has spread to several other countries, and the World Health Organization announced 30th January 2020 that the latest outbreak is a public health emergency of international concern. And as of 30th November 2020, when I'm doing the assignment, 62,787,929 confirmed cases of COVID-19 have been identified by the WHO globally, with 65,697 occurring in Malaysia, including 2,112 serious cases and 360 deaths. So currently no vaccines for the prevention of COVID-19 are currently available at this moment, and in this absence of this particular coronavirus vaccine, social distancing and population lockdown are among the most significant considerations, taking urgent and precautionary steps. So I have listed around 6 issues and problem statements for my research. Number one, common emotional responses during this pandemic crisis were debilitating fear of contagion, isolation that can induce feeling of loneliness, boredom, anger, and anxiety, as well as sense of uncertainty. So this disease has globally infected the population with additional health conditions such as depression, anxiety, depressive symptoms, insomnia, denial, frustration, and fear, which actually because most of people have to stay home and avoid meeting other people and close interaction with others. So this is some of the effects caused by this global pandemic, and also because of the current recessions happening in the country. Number two is about air pollution. High levels of air pollution affect the body's natural defenses against airborne viruses, increasing the possibility people will contract viral diseases, even possible with COVID-19, which exposure to air pollution is an essential risk factor for many of the chronic diseases that make people become seriously ill, unhealthy, require intensive care, mechanical ventilation, and even die from COVID-19. So this is very crucial and very important issues which we have to treat the air pollutions in the cities to limit the spread of this virus and makes people become deteriorated. So number three, about the exercising, which have been shown to have a clear health benefit for healthy people and patients with various illnesses. And in order to protect the body and reduce the harm caused by the COVID-19 disease, the value of regular involvement in some form of physical activity for physical and mental well-being is essential. So number four is about preserving public access to city parks to allow people to maintain a safe and responsible distance, because park is very spacious. Park is a very big space, and this space might be able to give people for social distancing because it's not a confined spaces. So nature and green space exposure also has positive physical and mental health benefits, and the closing of some parks is more likely to affect disadvantaged communities than others, and stress relief may result in people entering less desirable and more congested spaces because they'll not be able to enter the park. So in order for them to release some stress, they might be able to go to the confined spaces, indoor spaces, which will be it's going to be high risk for them to contract the virus because of the confined spaces. So number five, the temporary closure of some public parks due to the huge numbers of people visiting public parks during the pandemic crisis and not complying with the government's SOP guidelines. And improvement in scheduling should be made to better control the number of visitors at the time and allow adequate physical distance. Number six is about a healthy design. The ongoing COVID-19 pandemic is a strong reminder that urbanization has changed the way people and societies live, work, and communicate, and it's very important to build a resilient, healthy environment, mainly outdoor spaces, to prevent the spread of infectious diseases in the future. So my research questions, I have listed 3 research questions, which are: what are the benefits that the community can obtain if they spend at the park, particularly during this pandemic crisis? Number 2, what are the recommendations that can be done towards the current public park in Malaysia to ensure on the safe use of the public during the COVID-19 outbreak and can be opened during pandemic? Number 3, what are the good criteria and strategy in developing the healthy landscape design environment that can be resilient toward COVID-19 and future pandemics? I have listed 2 hypotheses, which are urban park plays a vital role in times of pandemic crisis as it can improve and promote overall physical and mental well-being and help meet individual needs for social interactions, which also it can improve urban environment. It can reduce air pollution by cleansing the air. Number 2, adaptive measures for urban park during the pandemic outbreak is crucial to ensure our public are safe, our cities are resilient, and our society is healthy. So my research aim is to suggest the development of healthy living environment designed for urban park during COVID-19 outbreak and future pandemic. Research objectives. I have listed 3 research objectives, which are to identify the critical role of urban park in this time of pandemic crisis, to identify the new park management criteria and recommendations to ensure on the safe use of the existing public park to the public and the park can be open during the pandemic crisis. And number 3 is to propose the development of healthy landscape design environment that can be resilient to COVID-19 and other future pandemics. So literature reviews, I have listed 10 literature reviews from a few journals, which are number 1 is about the what are the benefit of parks, what the parks can be beneficial to the public, because normally parks are a place where we go to spend outdoor in touch with nature, enjoy the view of landscapes, and it also important a place for people to meet or engage in social events or to play or participate in physical activities and sports. So this is the first literature review. Number 2 is about social interactions, which is very critical in everyday's urban residents' life. So having a quarantine have resulted in substantial restrictions on the social conduct of the residents, and which is going to prevent them from like socializing and meeting other people, and they are also prohibited from accessing public places and must maintain a certain distance from others and prevent physical interactions. Number 3 is about air pollution, where there's a lot of researchers which prove that urban greening can directly minimize air pollution as dust and particles of smoke are trapped by vegetations, and it also suggested that on average 85% of a park's air pollution can be filtered through the vegetations. Number 4 is about stress and anxiety resulting from household confinement conflicts and economic recessions triggered by a pandemic that often result in involuntary jobs and loss of income, which can be turned into a very full-fledged mental health crisis. Number 5 is about physical exercise. Literature review about physical exercise, which proven to minimize the severity of infections with COVID-19. Because of when we exercise, we have a very strong antibodies which can defend against infections. It can have a strong immune system which can prevent us from getting these diseases. So, but during the COVID-19 pandemic, the closing of several parks and green spaces will reduce the physical activity opportunities and could impact vulnerable populations more than other populations, which is not good if the park is closed during pandemic. So number 6 is about healthy design, where well-connected parks which allow proper social distancing is very crucial, like widening the bicycle lane, running path, and it's also proven that several cities temporarily closed streets in the early pandemic to facilitate physical distance, pedestrian and cycling activities. So number 7 is about the change of perceptions of green spaces and green area distributions, which might affect this pandemic might affect the size of public green area allocations in the future, because we need more green area and more bigger space to cater the bigger crowds for a social distancing. So this is something that I want to study and I want to do research more about this, locations of the space of the green areas. Number 8 is about a statement, one of the literature review, which stated that parks are a key feature of a resident city, partially due to their capacity to be converted for emergency health purposes. Okay, number 9 is about healthy design. I studied a lot. I've read a few journals, and I found a lot of criteria in developing healthy design, in terms of design, where one of it are modular designs as a protections from the risk of infections, and also providing parklets. Parklets are actually a former parking spaces that have been converted into a miniature public spaces, often adjacent to the sidewalk. Means that actually existing parking spaces can be converted into a miniature public space and can be used to the public, so that they can spend outside rather than spend inside confined spaces. And number 10 is about park management, where a few criteria I have identified for the park to ensure that it can be open during the pandemic, which such as limited access nodes, established one-way mobility circulations, allocations of checkpoints for surveillance and recording opportunities, restrictions on shared facilities in public places, and also temporary regulations to monitor and restrict certain activities in public places. These are some adaptive measures can be taken for the existing parks to face the current pandemic outbreak. So these are all my references, which I've listed 17 journals, which are, I can say that 95% are latest journals 2020, because this is the current and latest issue. So most of the journals that I sources are the latest one. Only about 1 or 2 are older journals, and I'm looking forward to done more still studies about this topic. I think that's all for now.